Hey community, we're back and I'm Brandi B, the community MP.
And I'm Brandi G, the community MP.
Today we're going to be talking about depression because it's around the holidays and a lot of people experience depression during the holidays. B, why do you think that is?
Because they got to buy all those gifts.
Yeah.
No, I'm really, I'm sorry being silly. But no, I think people are, a lot of pressure is placed on people because Christmas is known for gift giving. And sometimes you may not have the means or the money to buy lots of gifts.
Yeah.
And so true. That can stress you out, give you anxiety, and you get depressed because you can't afford to buy those gifts.
Yeah, and nobody wants to let their kids down or their family down. And so it is stressful, primarily for, I would say, parents.
Yes.
And then also I think people did, a lot of times people are sad during this time because of like loss of family members and not having grandma at Christmas and things. But yeah, so anyways, let's talk about some what depression is. What is depression?
Okay. So depression is a disorder that makes you feel sad. It's not only that you feel sad, but you feel sad for a long period of time. We all may have some points, some days where we don't feel happy, we feel sad, but depression is when it lasts for a long period of time. It can interfere with our ability to work, go to school, just anything that we do in our everyday lives.
Yeah, like cooking, cleaning.
Yes, because depression don't want to clean.
No.
Sometimes people don't want to cook. Sometimes people cook too much when they're depressed. So it just alters our everyday life. There's several different types of depression, and Brandi, you're going to describe some of those or give us some examples.
I'll just give you some examples. So there's postpartum depression, which happens, like the females that after they have the baby, then they get sad. Also, I think people refer to it as the baby blues.
Yeah.
But if it lasts a long time, then it's postpartum depression. Then there's major depression, atypical depression, bipolar depression. There's seasonal depression, which is kind of what we were talking about with the holidays and stuff.
And that's just a few to name because there's a lot of different forms of depression.
Very much so.
So let's talk about some facts. So when I was reading about depression, I saw that around 17.3 million adults have had some type of episode, at least one episode of depression. So that's a lot.
That is.
Like, that is a lot.
That is. And a lot of times, people who are depressed don't even reach out for help and stuff. So that number is probably lower than what it actually is.
Yes.
But depression is most common between ages of 18 and 25, and it's more common in
females.
Yeah,
females than males.
Yeah.
And the 18 to 25 range is transitioning from high school to college or from high school to the job force, the workforce.
Yeah.
So I can see where that age range is probably, why it's so high in that age range.
And then those young adults, they compare themselves to others, especially with social media now. It's like,
oh, girl,
I should be doing this. I'm comparing my life to this person. I want these goals.
And they don't realize social media be 2 or 3 takes, 4 or 5 takes before they post something or put a video up. They edit it, so
you're not seeing the real deal. Then one interesting fact that I read is that depression is more common between people of multiple races, so like biracial kids or adults. And I think that has to do with like, the two cultures coming together, and then they have a parent that believes this, and then a mom that believes, or a dad or the opposite parent to believe something else, and they bring it in two cultures. And so I think that person probably is trying to figure out like where they belong,
where they fit in each
That's
culture.
Just my opinion.
If you guys have some opinions about that, please let us know.
Yeah, because we'd be interested to know like your experiences. And then the other thing was in adolescence, what is it, 3.2 million kids? That's a lot. Yeah,
that's a lot. So that just tells us that we need to be mindful and start really watching our kids, making sure they're not, depressed. Just getting in their business, basically. Digging in their businesses to see,
Because depression leads to suicide, and the suicide rate in teens is very high.
Okay. Wow. Okay.
Yeah. So what's some signs of depression?
Gaining weight, because all you're doing is, you're sad, so you want to eat. That may be your way of trying to deal with it. Losing weight, you're not eating at all, because you just don't want to eat. Getting too much of sleep or not getting enough sleep at all. Feeling tired, not having any energy, forgetting things. Yeah. Like you're just forgetting that things, or you're confused.
Yeah, and in like the advanced stages, you may start to speak slow, move slow, think about death and suicide, which we keep bringing that up because it's huge. Like the suicide rate just keeps going up and up every year, and a lot of times the people will have depression first, but the signs and symptoms are ignored.
Yes, so that's some signs.
Yeah. So if you notice anybody with signs of depression, reach out to them. Yes. Let them know that there's resources out there. There's help. There's things that they can do.
So risk factors. Okay. Yeah. So family history, of course. If you have a family history of depression, you most likely may have depression. Low self-esteem, and I see this in a lot of my teenagers, adolescents, teenagers, and some of the women between, I say, 18 and about 25, I sometimes see the low self-esteem that causes their depression.
I blame it on social media.
Yep. Blame it on. Yeah, but no, really, yeah. You're right.
And bullying.
Yeah.
So you say things unknowingly. You may be like, oh, this is my friend, but girl, you so fat.
Yeah, so yeah.
Girl, you thick. Like, people don't want to hear that.
Yeah.
I feel like in the Black community, like, you go to see your family, and that's the first thing that they have.
You done gain weight. I'm like, okay,
I'm doing well.
Gain weight.
Thank you.
I've been in the mirror looking. Yeah. I know I'm not working out like I used to, so I don't need you to tell me that I'm gaining weight.
Or like,
sometimes that can make you feel like, oh, okay.
My niece brought it to my attention. She had posted something, and she was like, about body shaming skinny people. Because, even saying like, oh, you're so skinny, you think like, well, for me, I'd be like, oh, you're so skinny. I'm thick. I'm trying to get to where you are. But to them, it makes them self-conscious. They're like, oh, I'm skinny.
My daughter deals with that also. Because she's small. So she was like, sometimes I don't want to be small, but people always make a point, oh, you're small now. Yeah. So,
Just leave people alone. Yes. But some other risk factors are like kids. Well, you may notice this more in kids, like behavioral problems. They may be more aggressive. They may act out at school. Sometimes they're dealing with depression, or that could lead to them developing depression just because they're always, being corrected, and then they'll start to feel sad. So childhood trauma or adulthood trauma, stressful life events, parental loss, divorce, marriage, low social support, and lack of education are also risk factors for developing depression.
So one that we didn't mention yet was substance abuse.
Oh, yeah.
Yeah, substance abuse. Because I know a lot of my patients who may be struggling with substance abuse, they got into it because that was one of the ways of coping with what was going on in their lives at that time. So substance abuse.
Yeah. And then sometimes substance abuse can lead to depression.
Yeah.
So you get on drugs, you start to feel hopeless, you don't know what else to do, and you start to feel sad.
Yeah. So it can go both ways, right? You're absolutely right. So B, what are some of the treatments?
So there's several types of therapy, and we always recommend, and I say we because I know that you do too, but we always recommend in the treatment of depression to always include therapy. Because talking through the situation, we can mask the situation, with medicines, but it's good to talk through it so that maybe you don't have to be on medication forever, if at all. But there's CBT therapy where it reshapes your behaviors and patterns, your thought patterns. There's interpersonal therapy, family and couples therapy. People use that, like if they're going through like marriage, divorce, death of a loved one. So just instances where more than one person in the family may be feeling depressed. And then there's problem-solving therapy, psychodynamic therapy, which focuses like on childhood traumas and working through that, trying to figure out a way so that those things that happened to you in the past aren't affecting your current situation.
Okay, so also, one of the treatments can be medication, antidepressants. And I know sometimes, a lot of patients just want, give me a pill to help my depression. But I try to tell my patients, okay, we can give you a pill, but like you said, you also need to go into some type of therapy or counseling also.
Right.
And one of the biggest complaints I get when I put them on an antidepressant is that it's not working. So with those drugs, people have to know it takes 6 to 8 weeks usually to work to get into your system. And I always tell them, if you're going to be on an antidepressant, don't stop it cold turkey.
Right. Yeah.
Call me, let me know what's going on. I can adjust the dose, but don't stop it cold turkey because it can cause other issues. What's one of the major issues it can cause?
Yeah, the major issue is suicide suicidal thoughts.
Yes.
So, that's what we keep bringing up just because it's real. And then some of the other things you can do: exercise, yoga, relaxation techniques.
What I needed this morning after having a busy morning in clinic.
Deep breathing. Yes.
Yes.
Yeah, so meditation. I think that I need to meditate.
I know I need to meditate. Especially when I leave work. Like, I know before I go to work and when I leave work, I need to meditate. So I won't bring everything home with me.
Yeah,
okay?
Yeah. And then you'd have to see a psychologist for this, but it's brain stimulation. So they have some things that they can do to alter the brain. But that's out of my pay grade.
Nice.
So, as we mentioned before, untreated leads to
suicide.
Mm-hmm.
Suicide. So we know that there's, like you say, there's many resources for those people who may be thinking of suicide or homicide thoughts. If it occurs, I tell my patients, call 911, go to the emergency room. If you have a telephone, there's a suicide prevention number, 1-800-2773-TALK. 1-800-2773-TALK, TALK.
And then there's also resources for substance abuse. So, and that number is 1-800-662-HELP. So if you like we said, there's plenty of resources out there.
Yes.
If you're feeling depressed or you notice the symptoms in someone else, especially your kids, get help.
Yes.
I know mental health has a bad stigma,
especially in the African American community. Yes.
But it's real conditions, and there is help out there.
I can remember growing up. People saying I'm not crazy. I need to go see a crazy doctor.
Right.
And so that was like the stigma that you was like, oh, if I go see a psychiatrist or a psychologist, something is wrong with me.
Right,
but it's a disease just like high blood pressure, diabetes. It's a disease,
and it needs to be treated.
Yes.
So, what we want our followers to do?
We want them to subscribe, like, share, and follow B&B, the Community in Peace,
on Facebook, Instagram, YouTube.
Yes.
And
is that it, B? I think that's it.
That's it. But we also want to let you know that this does not replace.
Oh, yes.
You going to see your primary care provider.
We want you to see your primary care provider.
Yes.
This is just to spark up a conversation between friends, families, you and your kids, so we can get talking about these different diseases. Yeah. So that's why we're bringing it to you guys, because we want you guys to talk about it. You never know, one of your girlfriends may be, depressed.
Yeah.
They may be going through something, and you spark up the conversation. Where I saw this YouTube video this week talking about depression. This was some of the signs. You never know what you can do for that person. So
that's very true. And then we gave you resources so you can help your friend, have your friend watch the YouTube and see if there's ways that we can help them.
Yes.
So
all right. So
that's it.
That's it. We'll see you guys next week, and
community is our beauty.